Mike, we can probably start. Mike,
Hello,
I
Mike.
think
You're on mute.
I think we lost Mike.
Oh, yeah. Oo.
All right, sorry about that. I think we're having some technical problems with our moderator. But anyway, so I'll be happily to take over the introduction for this webinar. So again, good afternoon, and thank you for being here today. I am Alan Villard from TÜV Rheinland Philippines, and together with me, we have Michael Nico Nervous from TÜV Rheinland's Business Advisory Group, and we are glad to welcome you to this session. Today, we will talk about how hospitals and healthcare institutions can work towards earning PhilHealth's seal of excellence and how third-party accreditation can help make that happen. We'll go over the goals of PhilHealth's accreditation, the value of independent assessments, and how TÜV supports healthcare providers in meeting these standards. This session is meant to give you clear, practical insights from understanding policies to improving internal systems and patient care. By the end, you will have a better idea of where your organization stands and what steps to take next. Let's get started and explore how compliance can lead to real recognition and better healthcare outcomes. So let's get started. Before anything else, Kay would like to introduce first, we are Tuberland. Our dedication to quality and safety is not just what we do, it is our passion. As a sustainable and independent global provider, our services span testing, inspection, certification, consulting, and training. Today, we aim to share insights that underscore our commitment to excellence and how we strive to be your preferred partner in achieving it. Tuberland People and Business Assurance embodies our essence, German at heart, but global in mind. We don't just ensure quality and safety, we guarantee people and business assurance through a wide spectrum of services, including occupational health and safety, training and HR development, labor market services, digital transformation, certification of management systems, customized services, and even government inspections and international trade. With over 200 locations across 26 countries, over 2,500 global trainers and health and safety experts and specialists, with more than 30,000 health and safety inspections done, we remain committed to providing technical competency and professional trainings and consulting to over 300,000 annual training participants, 30,000 personal certifications, and 750 certifications programs, making us as leaders in our field. At Tuverland, our business advisory group offers a wide range of consulting services to help organizations stay compliant, improve performance, and grow sustainably. Our key services include OHS compliance assessments, safety and quality management system and development, which are aligned with ISO standards, and process safety audits to manage operational risk. We also provide expert support in data privacy and infrastructure consulting, helping businesses protect sensitive information and meet regulatory requirements. While for the healthcare sector, we offer occupational health assessments and accreditation advisory services. We also assist companies with ESG reporting, ensuring alignment with global sustainability standards. Each service is tailored to support compliance, reduce risk, and improve efficiency across our organizations. Before we dive deeper, we here are some few housekeeping notes that we can ensure a smooth, productive webinar experience. You may submit your questions in the Q&A section. We will address the most common questions live and follow up on others or via email after the session. This session is being recorded for future reference. A link to the recording will be sent to you in our follow-up communication. To maintain a high-quality webinar experience, the audio and video functions have been disabled for participants. Your insights are invaluable to us. Please spare a few moments to fill out a brief survey after the webinar. Your input will help shape our future events. For your best experience, we recommend using a stable internet connection, preferably through a wired LAN setup. And now, it is my pleasure to introduce our distinguished speakers for today's webinar. Let's first start with Dr. Coracel Ontalan. She is a healthcare accreditation expert with 27 years of service at PhilHealth. She has led key roles in both benefit administration and accreditation, including 8 years as head of the accreditation section of the PhilHealth NCR. She played a major role in launching the benchbook standards and has led many hospital surveys as head surveyor in Metro Manila. Now serving as medical specialist at PhilHealth Central Office with a master's in public administration, Dr. Ontalan or Cora continues to promote quality management as a core part of a healthcare practice. Our second speaker, Dr. Mark Anthony Cepeda. He is the Division Chief of Policy Research and Standards Development at PhilHealth. He leads the creation and review of healthcare policies and service standards to support PhilHealth's goal of providing quality, accessible healthcare to all Filipinos. A licensed physician, he earned his medical degree from UERMMC and completed his residency in ophthalmology at Quirino Memorial Medical Center. His clinical background helps him align healthcare policies with real-world medical practice and the needs of the sector. And lastly, our third speaker, Dr. Lizelle P. Lagrada. Dr. Lagrada is a public health expert with over 25 years of experience in health policy, systems development, and quality improvement. She has worked with organizations such as the World Health Organization, World Bank, USAID, and PhilHealth. Her work focuses on healthcare quality, equity, and universal health coverage, both in the Philippines and internationally. She is also an associate professor of public health at the University of the Philippines, Manila, and holds a doctor of public health in leadership. Dr. Lagrada is known for connecting global health strategies with real-world solutions on the ground. Please join me in welcoming our expert speakers, Drs. Ontalan, Dr. Cepeda, and Dr. Lagrada. So to officially start this webinar, I will be handing now over to Dr. Cora Ontalan.
Good afternoon to everyone. So I'm Dr. Ontalan from the Accreditation Department of the Philippine Health Insurance Corporation. And for this afternoon, I am tasked to present to you the various issuances released by the corporation in relation to the implementation of the third-party accreditation. Next slide, please. So for this afternoon, I will be presenting three of the PhilHealth circulars, namely PhilHealth Circular 2023-0011, which is on the recognition of TPA mechanisms. The next circular is 2023-0022, which is recognizing third-party accreditors. And lastly, the PhilHealth Circular 2024-0019, which is providing incentives to health facilities demonstrating better service quality, efficiency, and equity. And I will be giving you a short overview of the benchbook for hospitals, second edition. Next slide. So this issuance says we have a legal basis which is under the Republic Act 11223, or otherwise known as the Universal Healthcare Act. In Section 27 of the said law, PhilHealth shall establish a rating system under an incentive scheme to acknowledge and reward health facilities that provide better service quality, efficiency, and equity, provided that PhilHealth shall recognize a third-party accreditation mechanisms and may use as basis for granting incentives. Further, in this section, PhilHealth shall prescribe the standards and requirements for third-party accreditation mechanisms. They may be used as basis for granting incentives to healthcare providers to be identified by PhilHealth. On the next slide, we have tabulated the important terms we encountered in the UHC. So the rating system shall be based on the benchmark standards for hospitals and non-hospital facilities. Then the incentive scheme, which is the awarding of health facilities with exemplary performance based on service quality, efficiency, and equity as center of excellence. And the third-party accreditation, as mentioned in the section 27 of the said RA, there is a recognition of a third-party organizations that will assess the performance of health facilities using the benchmark standards. Next slide. So let us go through the said circular. The objective is to establish the guiding principles and the third-party accreditation mechanism for health facilities of the corporation. The scope of this particular issuance is to establish the criteria, standards, and requirements for the recognition of the third-party accreditor. And this shall also cover all applications for third-party accreditation received upon the effectivity of this particular circular. Next slide. So let me go through also some of the terms that we will be encountering in the next issuances also. So we made mention of the bench book. Sa mga kasing edad ko po sa PhilHealth, yung mga hospital po na matagal na pong accredited sa PhilHealth, I know you would remember the bench book which we used in accreditation back in 2010 and 2011. So we have edited and we have revised the bench book. We have the second edition to be used for this third-party accreditation. So the bench book is a document that serves as a yardstick for measuring and assessing the quality healthcare rendered by PhilHealth and the accredited health facilities and professionals, which lays out basic concepts on the value of quality assurance in healthcare and how accreditation process supports continuous quality improvement. So mamaya po, medyo paulit-ulit natin ma-mention itong bench book because the standards that will be used for assessing you by the third-party accreditors will be based on the benchmark standards. So we have also the financial risk protection, which is the protection of the population from high and unexpected cause of illness. Next slide. We have the healthcare providers. These are categorized into three major groups. The first is the health facilities, which includes hospitals, katulad po yung mga attendees natin ngayon. They may be public or private, devoted primarily to the provision of health services for health promotion, prevention, diagnosis, treatment, rehabilitation, and palliation of individuals suffering from illness, disease, injury, disability, or deformity, or in need of obstetrical or other medical and nursing care. Next slide. We also have the healthcare professionals. This may be physicians, doctors of medicine, nurses, midwives, dentists, or other allied professional or practitioners duly licensed to practice in the Philippines. And thirdly, we have community-based healthcare organization, which is an association of members of the community organized for the purpose of improving the health status of that community. So we are, PhilHealth is already into networking, and we are currently studying the possibility of group accreditation. Next slide. So we made mention of third-party accreditation. This is the mechanism whereby PhilHealth shall outsource the assessment of health facilities to duly recognize and authorize third-party entities for the purpose of granting incentives. And we have the third-party accreditors such as the TÜV, which is an organization or entity recognized by PhilHealth to assess the compliance of the health facilities to the standards set by the corporation. Next. So we go through the policy statements for this particular issuance. So the corporation shall implement a TPA mechanism to look into the quality performance aspects of accredited health facilities with intention to be incentivized under this TPA mechanism. The accredited health facilities shall be assessed using the bench book for hospital second edition, and eventually we will be also launching the bench book for the non-hospital facilities. The TPA process shall be on top of the current accreditation process and shall be the basis for the granting of incentives to health facilities with exemplary performance in line with the provisions of the UHC Act. Ano pong ibig sabihin nito? Previously, in 2010 and 2011, the bench book was a mandatory, we conduct a mandatory survey using the bench book for the facilities to have an accreditation. But this time, with the third-party accreditation scheme, this shall not affect the current accreditation of the health facility. This is something voluntary for those facility wanting to be recognized as a center of excellence. And lastly, last bullet, the corporation shall recognize third-party accreditors to assess the health facilities qualification for the incentive scheme under the TPA mechanism. Next slide. So the third-party accreditors, such as the TÜV, shall comply with the following standards and requirements. First, they shall also have an accreditation mechanism that ensures better health service quality, efficiency, and equity to all patients. They shall have a human resource which are available and qualified to provide comprehensive assessment of the facility within one cycle of accreditation and with the following. The human resource of this TPA organization must have at least a background in health science or qualifications in healthcare audit. Next slide. They must be composed of certified staff in relevant fields and has continuing professional development programs. The TPA organization applies total quality management approach. It must be a business entity that is organized, registered with the Department of Trade and Industry or with the Securities and Exchange Commission, and can present a local government unit business permit and licensing office, and have other relevant government offices and are compliant to applicable existing laws and regulations. Next slide. So the core medical unit audit team of the said organization, the TPA accreditors, shall include competent staff. It shall likewise have an in-depth understanding of parameters in assessing quality performance and qualification of the health facilities. So PhilHealth recommends the following members for the core medical audit team. We have medical officers or doctors, nurses and midwives, pharmacists, the medical laboratory or technicians, those who are administrators, data entry operators, programmers, statisticians, researchers and analysts, financial accountants, certified medical auditors, and fraud risk experts. These are only the PhilHealth's recommendation for the composition of the core medical audit team of the TPA. Next, we have the medical audit team members shall have a commitment and understanding of the plans and objectives of the medical audit system and the PhilHealth bench book. And the next bullet, next number is the TPA organization team should possess, again, knowledge of the PhilHealth standards and benchmarks, use of relevant information technology systems, and data management. Next slide, please. So the TPA should be an independent and reputable party that shall render impartial evaluation on health facilities operations, standard medical practices, and performance. Hindi po pwedeng since may kakilala sila dun sa hospital, nagkakaroon ng po ng impartiality dun sa magiging recommendation nila dun sa performance ng hospital. So they should be independent and impartial with their recommendation. The cost of accreditation is not prohibitive for the health facility to continue normal operations. The engagement shall be between the health facility and the TPA. shall be aligned with the relevant laws and regulatory requirements of PhilHealth and Department of Health. So ang ibig sabihin lang po dito, the engagement ng yung magiging relationship of the health facility with the TPA, hindi po kasama si PhilHealth sa magiging engagement. Later on po, medyo i-expand ko po doon. And there will be, unlike dun sa una pong launch natin ng bench book, which is not requiring any accreditation fee or not requiring any fee, dito po meron tayong ibang payment na mangyayari. So we'll explain it later po sa mga succeeding issuances. And on the 10th number, presence of mechanism of review or audit of performance of each self-nominated health facility under the accreditation program of the third-party accreditor. The results of review shall be submitted to PhilHealth within the prescribed period to be determined by the corporation. Next slide. So the TPA will be performed either by a locally or internationally recognized healthcare accreditor, and there will be a monitoring and evaluation TPA scheme. All health facilities which were granted incentives or which were recognized as Center of Excellence through this TPA or third-party accreditation shall be subject still to the existing PhilHealth rules on performance monitoring. So this first issuance was signed by our PCEO, former PCEO Ledesma, on June 21 of 2023. So the first issuance gives us all idea of what the third-party accreditation mechanism is all about. So the next issuance, which is PhilHealth Circular 2023-0022. Next slide. This is about recognizing third-party accreditors. So, sino po yung mga third-party accreditors? Yan po yung mga nag-intent na kapag-submit po sa PhilHealth ng mga organization who will do the third-party accreditation for this health facility, who would want to be recognized as centers of excellence. So, ito pong mga third-party accreditors ay isa po doon ay ang TÜV na nag-sponsor po ng ating webinar this afternoon. So, for this issuance, the objective is to establish the mechanism to recognize third-party accreditation organizations or bodies and the rules of engagement between the corporation and the eligible third-party accreditors. The scope of this issuance covers the mechanism pertaining to the third-party accreditation organizations with intent to participate in the incentive program and under this PhilHealth circular. Next slide. So medyo dadaanan ko lang po itong circular because this is particular for those third-party accreditors who would want to engage with PhilHealth as TPA recognized organizations to conduct the TPA mechanism to health facilities. So under this policy, the PhilHealth shall acknowledge and incentivize good performing health facilities based on the achievement of quality healthcare standards according to the bench book 2 for hospitals and the bench book for non-hospital facilities. So stated also in this policy is that the corporation shall recognize TPA organizations with established accreditation standards, both local and foreign accreditation or certification organizations to assess achievement of health facilities to quality healthcare standards. So pwede po dito mag-apply those who are local or foreign accreditation organizations. The PhilHealth recognized TPA shall conduct the survey, assess the achievement versus quality standards, and submits its findings to PhilHealth. Next slide. So the assessment by the TPA organization shall include the following but not limited po. So ito po yung gagawin nilang assessment sa mga health facilities. They measure the provision of complete and appropriate care. They look into health outcomes, patient satisfaction, how the facility uses their funds and allocation of resources, compliance to standards of clinical practice as approved by the Department of Health, submission of price information for goods and services, compliance to guidelines and standards as prescribed by DOH, PhilHealth, and other applicable laws, and other indicators as deemed necessary. Next slide. So those interested to participate, they may submit. Ito po yung mga gusto maging third-party accreditor. The letter of intent, a third-party accreditation profile, the list of members of their medical audit team, and their corresponding valid PRC licenses or its equivalent. The local TPA organization shall also submit additional requirements, SEC registration for corporations, DTI for single proprietorship, and the certificate of registration from the Cooperative Development Authority for cooperatives, and their copy of the BIR certificate of registration. Next slide. So selection of the third-party accreditors. PhilHealth shall select the TPA to be recognized based on the standards set by the corporations. Once selected, the organization shall execute a contract between PhilHealth stipulating the agreement. The agreement shall be valid for 5 years unless terminated earlier and shall be renewed within 90 days before its expiration. So dun sa mga, baka naman po may gusto rin maging third-party accreditor, ito po yung ating way of selection and as mentioned, yung mga requirements po. Next slide. So si TÜV po was able to submit and applied for this third-party accreditation and they are now recognized as a TPA third-party accreditor of PhilHealth. So the TPA shall have 6 months to complete their assessment of the facility and shall submit to PhilHealth an official report in hard and soft copies of their recommendation and data results. On our side naman, the PhilHealth shall provide the proof of recognition, selection, recognized TPA, and their name shall be posted in the corporate website. PhilHealth should also inform the TPA of any changes in the bench book and provide updates on the implementation of TPA. We shall also receive recommendations from the TPA for any improvements or any with regards to the incentivization program for third-party accreditation. Next slide. So, kung na-recognize po namin yung TPA, there are also conditions wherein we can withdraw or stop or cease the recognition of this third-party accreditors. So, the following conditions po, there is dissolution of the TPA organization kung nag-disband na po sila, kung ayaw na po nila maging isang kumbaga nawala na po yung organization. There is voluntary withdrawal of participation in the program kung ayaw na po nila mag-participate sa PhilHealth TPA mechanism. There is a verified collusion between the health facility and the TPA organization, or there is fraud, and there is cessation of the incentive program. Kung ito pong ating third-party accreditation is mawawala po, then natatapos na rin po recognition of these recognized third-party accreditors. So PhilHealth shall again monitor, recognize the third-party accreditors in compliance to the standards, and also we shall be evaluating their performance as a recognized TPA. So this circular was signed by our former president, PCO Ledesma, on November 8 of 2023. So ito pong second issuance is directed para dun sa mga organizations who would want to be recognized third-party accreditors. So yung mga nabanggit ko po, yan po yung mga na-submit din ni TÜV. Yan din po yung mga pinagdaanan nilang selection process for us, PhilHealth, to recognize them as one of the third-party accreditors. Next slide. So the last issuance is, ito po yung mas, I think, mas kailangan nating tutukan as health facilities. So this is the issuance PC 2024 of 0019, which provides incentives to healthcare facilities demonstrating better service quality, efficiency, and equity. This was signed by our former PCEO on August 22 of 2024. So the objectives of this issuance is to provide rules in the provision of incentives to health facilities that demonstrate better service quality, efficiency, and equity. So the scope is PhilHealth, the PhilHealth rating system for measuring quality of service. There is a mechanism to grant incentives to health facilities, and the rules of engagement between the corporation, the third-party accreditor, and the eligible health facilities. Next slide. So in addition to the terms that were discussed earlier in this presentation, gusto ko lang po idagdag yung definition natin ng Center of Excellence or the COE. This is an award given to a health facility that comply with the PhilHealth benchbook standards and obtain a minimum chapter level and overall average scores. The health facility shall be able to provide care that is timely, safe, patient-centered, and effective, and ensures that such care provides value for money, conserves healthcare resources, and promotes health equity. So, sa mga those interested to participate in this third-party accreditation, ang goal po natin is to achieve the Center of Excellence. Yung scoring po, later on, we have a separate presentation for that. The quality incentive or QI is an incentive granted to a health facility that provides quality health service based on the recommendations from PhilHealth, recognized third-party accreditor that utilizes the benchbook as the rating scheme. Next slide. So the policy states that all currently PhilHealth accredited health facilities exhibiting exemplary quality services may apply in the incentive program. So pwede po, this is open to all accredited facilities that think that they may achieve the standards under the benchbook 2. PhilHealth shall acknowledge and incentivize good performing health facilities based on the achievement of quality healthcare standards according to the benchbook 2. The benchbook standards can be accessed from the PhilHealth website. So I think may question po dun sa advance na kinuha natin from the participants. The benchbook po can be is available and can be accessed through the official website of PhilHealth. Health facilities intending to access the quality incentives shall first undergo a self-assessment using the benchbook standards through a prescribed self-assessment tool or the SAT and accomplish the score sheet, which are both accessible also in the PhilHealth website. So tulad din po ng dati nating procedure are those yung mga ginagawa po natin during pre-contracting surveys natin, we do have a self-assessment. Ang gagawin po muna ng facility is to check their own facility kung sila po ay makaka-comply dun sa mga hinihinging standards under the benchbook. Next slide. So for those health facilities intending to avail the quality incentive shall comply with the following. Ito po yung mga criteria po natin. The facility must be accredited for at least 3 consecutive years prior to application. they must be granted a regular accreditation at the time of application. So yung mga provisionally accredited po ay hindi po muna natin mapag-a-apply. Those facilities, dapat po wala rin silang pending case, any appeal or motion for reconsideration that involves fraud with the arbitration office or PhilHealth board or any other court. So wala pong pending case under this, before these offices. Next slide. So the assessment of the health facilities, as mentioned a while ago, will includes the following but not limited po. So primarily yung patient care, appropriate care given to their clients or patients, health outcomes. They will look also into patient satisfaction, the allocation of resources, compliance to clinical practice guidelines, and guidelines and standards set by DOH, PhilHealth, and other agencies. And they should be able to submit information of their goods and services to uh, agencies, government agencies. Next slide. So facilities that are interested and qualified shall undergo the following process. So first nga po, yung na-mention ko kanina, is to conduct a self-assessment using the SAT as accessible in the PhilHealth website. Fill out the benchmark score sheet, which is also accessible in the PhilHealth website. Contact a PhilHealth recognized third-party accreditor for the assessment of your compliance to the benchmark standards. Send a letter of intent to a recognized third-party accreditor. Copy furnish the Senior Vice President of Health Finance Policy Sector of PhilHealth, who is Dr. Israel Francis Vargas. So the TPA shall submit to PhilHealth the health facilities score and its corresponding recommendations once they were able to assess or survey the facility. Next slide. So PhilHealth shall review the performance of the health facility based on the third-party accreditor's report and their compliance to the standards set in the bench book. Any agreement between the TPA and the health facility shall be solely between the two parties. To be eligible as Center of Excellence, the facility must be able to reach a bench book score of 22 to 26. They shall be able to meet all provisions in Section 5, Item E of this circular, which states that they must be currently accredited with regular accreditation. They must be at least 3 years PhilHealth accredited and no pending case with the corporation for any fraudulent violations. And lastly, PhilHealth's approval of the TPA's organization's recommendation shall be for the granting of the COE award. Next slide. So the Center of Excellence is valid for 3 years, subject to the renewal of the accreditation of the health facility within the 3-year validity period. So, ibig sabihin lang po, if you are granted the Center of Excellence and sa accreditation status nyo naman po is 1 year accredited lang po kayo, ang mangyari po is you still need to apply for accreditation on the succeeding years po while you have the validity of the COE. For the succeeding 3 years nga po, once na matapos na po yung validity nyo as a COE, there should be a new assessment which shall be done at least 6 months prior to the expiry of the COE award. So para makapag-renew po with your Center of Excellence, you must submit 6 months prior to the expiry of the COE award. The health facility shall submit a letter of intent to its preferred third-party accreditor at least 6 months nga po prior to the end validity of the COE award. The health facility shall strictly adhere to the bench book standards at all times during the validity period of the award. Next slide. Any of the following conditions may result to the withdrawal or suspension of the COE. First is there is a conviction due to violations of fraudulent nature against the National Health Insurance Act or the UHC Act and their respective implementing rules and regulations. There is a withdrawal of the accreditation of the health facility, and there is a voluntary withdrawal of the health facility from the award, and there is a cessation of the recognition of the TPA organization. So yun po ang pwedeng conditions that may suspend the granted Center of Excellence Award. Next slide. So there is a transitory provisions for 2024 and 2025 for the implementation of the third-party accreditation. So the program shall be initially implemented among qualified hospitals, open both for government and private. The corporation shall grant non-financial incentives for those awarded as COE. The Centers of Excellence facilities shall receive the following: a quality incentive by recognition as a Center of Excellence, a plaque of recognition, and the posting of the name of the facility in the PhilHealth website as a Center of Excellence. So may mga nakita rin po akong tanong na if there is any, what are the incentives for this third-party accreditation scheme po. For now po, the corporation shall not grant any financial incentives. It's just a recognition. It's a recognition as a Center of Excellence, So next slide. So I will just be giving an overview, a short overview of what the Bench Book 2 is about. So we mentioned that yung standards po will be based on Bench Book. So ang Bench Book po ay meron siyang 13 performance areas, and for this second edition, we have divided them into patient-centered standards, which are the following: patients' rights and organizational ethics, access to healthcare, inpatient admission and outpatient registration, assessment of patients, the standard on care planning and care delivery, medication management, and surgical and anesthesia care. The other set of standards, next slide, is the facility-focused standards, under which are the leadership and management, human resource management, information management, safe practice and environment, infection control, and improving performance. Next slide. So in the Bench Book, you will be encountering the word standard. This is a measure that provides the basis of the objective evaluation of the organizational process that help the healthcare organization measure, assess, and improve their performance. Next slide. So we also encountered the term goal. This represents the intent, the rationale, or justification that underpins the standard po. Next slide. You will also encounter the word performance criteria. This is a compliance to each of the criteria for a particular standard. Next slide. Next slide. So evidence po, these are gathered by three main methods. First, we have observation of practices, review of documents, processes, and outcomes, and interview of staff, patients, management, and other like relatives, family, kasama po dyan. So, yung evidence po, ito po yung tinitignan ng mga accreditors po. They will ask for proof of mga copy po ng documents, copy ng some policies. They will observe your implementation of these policies and to validate also, in addition, interview of the staff, patients, and the management. Next slide. So, ganito po siya nakikita dun sa bench book. So, yan po yung mga na-mention nating terms. We have standards, criteria, indicators, and evidences po. So, under evidences, we have documents, direct observation, leadership staff interview, and we may also interview the patients. Next slide. So in summary po, the new bench book, the new edition of the bench book has 13 performance areas, 108 standards, 441 criteria. The core criteria totals 47 po, and there are 41 quality criteria and financial risk protection criteria na total of 6. So ang core criteria po, mandatory po na ma-achieve po ng facility. Next slide. So that's it. Medyo mahaba po, but in summary po, the first issuance po gives us a the what the mechanism, the third-party accreditation mechanism is all about. Yung second issuance po is directed for those organization interested to be a third-party accreditor. And the last issuance that I have discussed is for the health facilities to be guided on what they will be needing to submit and how the process of the granting of the Center of Excellence, how the process and what are the criteria for the granting of Center of Excellence. So thank you all for listening.
Thank you so much. Thank you so much, Dr. Cora. All right. Okay. Now, I know that we have still lots of time, but if you haven't, please feel free to send in your questions. We'd love to hear from you. So you can see at the bottom part of your Zoom, right? You will have there the Q&A chat box, so you can drop in your messages or your questions, and we'll make sure that they will be addressed during this discussion. So for our next speaker, I would like to call on Dr. Mark Anthony Cepeda, okay, for his presentation. Just give me one moment first. Mike, you can do the presentation, right?
Yes.
Okay, I will stop sharing now. Okay, you're now sharing, right? Okay, perfect. Take it away.
Okay, good afternoon to everyone. First of all, I would like to thank TÜV Rheinland for this invitation, and especially, of course, Dr. Lizard Lagrada. So my presentation is about the scoring process in benchbook for hospitals. Okay. Next slide, please. But before I proceed, I would like, I understand that the scoring process has already been part of the orientation that PhilHealth conducted nationwide last year. And so maybe this is just a refresher to everyone, I hope. Okay. So as you can see in the slide, this is a visual of the scoring process up to the level of the criterion. The individual criterion is scored along two parameters, as you may recall, proof of performance and track record at the bottom part of the slide. The individual criterion is scored along two parameters, the proof of performance and the track record. Therefore, the criteria are individually scored and averaged for each standard. Going back to the proof of performance, as you can see, is a combination of all the evidence scores. So therefore, you need to assign a score to each evidence first. Okay. And there are different types of evidences, no, such as document review, patient chart, uh, staff interview, leadership interview, patient interview, and direct observation. Okay. So again, the scoring starts from evidence, no, as you may recall. And then it will now give you a combination of all the evidence score will give you the proof of performance score. And you combine that with the track record that will give you the criterion score. Okay. Okay, next slide. So as mentioned, these are the types of evidences, no? Document review includes the patient chart review, by the way. Okay, so in benchbook, scoring is a triangulation of these pieces of evidence in order to establish consistency of compliance to a specific standard. One important note during in scoring, particularly the patient chart, it usually requires at least 3 patient charts to be reviewed. However, there may be cases that only one chart, because it may not be a common occurrence. I'm referring to DAMA, no? Discharge against medical advice. So, usually, okay na po yung one chart na re-reviewin ng surveyor. Okay? As compared to the usual 3 charts, no? As in most cases. Okay? And of course, direct observation is only applied as applicable, no? Based on the standard. Okay, next slide. This slide is shows you the self-assessment tool, no? As mentioned by Dr. Corosel a while ago, that the self-assessment tool has been is already in the PhilHealth website. No, so you can view it, you can review it anytime, no? And this was also explained to you or during the orientation last year, no? So this is an example of the self-assessment tool, no, with single evidence or one evidence, which is chart review. Okay, so below is the instruction on how to score, no, this evidence. No? Okay, next slide. And this slide naman shows you 2 evidences, no, 2 pieces of evidence: staff interview and direct observation. And in the self-assessment tool again, it now it describes or it will explains how you score, no, each evidence, no. Okay, so for staff interview, usually the surveyor would select 3 relevant hospital staff. Okay, and then series of questions will be asked just to validate, no, if the specific standard is being followed, no, or is being followed in the hospital. And then yeah, next slide, please. This slide shows you 3 pieces of evidence, no, document review, staff interview, and patient interview. Okay. Next slide. So this is the step 1, no? Score each evidence first. So the assignment of score for each evidence is based on a 4-point scale. 0 being the lowest score to be assigned. 3 being the highest score to be assigned. And anything in between is 1 and 2. Okay. For the score of 0, meaning none of the observations show compliance, or if it is a document review, the document does not show all the expected elements, no. Or if it's a leadership interview or staff interview or patient interview, none of them was able to answer the surveyor to convince the surveyor, that he or she is knowledgeable or was able to establish familiarity with the process being asked. So to give a rating of 0, the surveyor must ascertain that the facility truly cannot show any evidence of compliance. For a score of 3, the highest score means 100% of the observations show compliance, or the documents has all the expected elements, or the leaders or the staff or the patient uh, exhibits sufficient knowledge or was able to establish familiarity with the process being asked. To award a rating of 3, the surveyor must ascertain that all the evidence gathered during the survey fully corroborates each other in conforming consistent compliance. Okay. So again, the 1 and 2 scores are to be assigned when there is partial compliance. Depends on the completeness of evidence or proof presented by the hospital. Okay. Next slide. Okay, the step 2 is by the way, this slide is for training or orientation purposes only. Okay. The table being presented show the various combinations of evidence scores resulting to corresponding proof of performance score. Okay. So for the left-hand side shows you a 2 table evidence, while the right-hand side shows you the 3 uh, table evidence. Next slide. Okay. This slide just shows you that for a single evidence like this one, chart review, the evidence score is automatically the proof of performance score. Okay, since there's only one evidence. Okay, next slide. Okay, so we're done with the proof of performance on how to get the proof of performance, based from the evidence scores. And then the another parameter is the track record, how to determine the score for track record. This table shows you that if the process is present, based on evidence, based on document, maybe is there for 1 year or longer, a full score of 2 is assigned, But if it's a new policy, for example, based on the date of implementation, it's just less than 5 months, like 0 to 4 months, then a score of 0 will be assigned. Now, if the implementation, if the duration of implementation is just less than a year, like 5 months to 11 months, then a score of 1. Okay. So of course, because yung Center of Excellence kasi means the hospital already has a culture of quality. So culture is not overnight, it doesn't happen overnight. So of course, if the process has been there for more than a year, then the hospital has the chance of getting the full score of 2. Next slide. Okay, just an important note on the scoring track record. As you note as you have seen, in the self-assessment tool, na meron po doon na scoring track record is not applicable, So there's no numerical value that will be assigned no, in the score sheet. These are the evidences like interview of patients or staff or management, no, and direct observations, because these are the types of evidences where track record may be difficult to establish. Okay, um, the score sheet is not left blank, but rather you put not applicable, no, as one of the options to be selected under the track record. Next slide. When is scoring of track record applicable? Of course, when during ano lang po, documentary evidence, no? These are the patient chart, policies and procedures, monitoring reports, no? Anything where there's documentation, no? So it's really important for the hospital to write the dates, no? Because that will be the reference of the surveyor that this has been existing for some time. Okay. So if no date is indicated in the document, for example, in the policy document, there's no date indicated, then that will be treated as no track record and a score of 0 shall be assigned. Okay, next slide. And now, we have now finished scoring the proof of performance and the track record. Now, we now combine both parameters in order to get now the criterion score. So, ngayon pa lang po, makukuha yung criterion score, no? So, when you already have the score for proof of performance and you already have assigned score for the track record, then a combination of this numbers will give you that criterion score based on this table. Okay. So for example, if the proof of performance is 0, the track record is 0, then of course the criterion score is 0. If the proof of performance has a score of 1 and then combines with 0, then the criterion score is 0. If the proof of performance has a score of 3 and the track record is 1, then the criterion score is 1. Also, NA track record, when combined with a numerical value under proof of performance, has a corresponding criterion score. So a proof of performance with a score of 1 plus a not applicable track record will give you a score of 1. No? 2 plus NA score of 1. 3 plus NA is a score of 2. Okay. Next slide. Again, for this slide and the next one is for orientation or training purposes. Okay. It shows you the table of scores. No. This time now, you will see now in getting the standard score. In getting the standard score, get the sum of all the criterion score divided by the number of criteria. Okay, next slide. And to get the performance score, get the sum of all the standard scores divided by the number of standards to give you the overall the performance area score. Okay. And step 7 is to get the overall score, you have sum up all the performance area scores. Okay, next slide. So to be eligible for COE or Center of Excellence, the overall performance score of the hospital should fall within 22 to 26 points plus compliance to all core criteria. By the way, there are core criteria assigned in bench book which are important, no? I think there are 47 core criteria. These are important criteria and that must be complied by that must be complied, no? So it should be 100% compliance, no, in order to be eligible for COE. Okay, the steps 1 and 2 are the levels reflecting how close towards the achievement of COE. Okay, next slide. So again, the hospital must comply with all the core criteria and attain at least the prescribed overall passing score to qualify as COE, that is 22 to 26 points. Okay. Okay, next slide. I think that's my last slide. So thank you very much. It's a short presentation on scoring. Thank you.
Thank you very much, Doc Mark. Now we're moving on to the next part of the program we're in. We will explain on how TÜV Rheinland, can help your organization in achieving, or how we can walk you through, the process of achieving the Seal of Excellence. So maybe I kindly call on the next speaker, Dr. Lizelle Lagrada. Doc?
Thank you. Yeah, thank you, Mike, and good afternoon to everyone. Thank you for joining us this afternoon. And thank you also to my fellow panelists, Dr. Cora and Dr. Mark from PhilHealth. Okay, so TÜV Rheinland had been accredited by PhilHealth as TPA last year, no? But to put context into the role of the TPA in the process of health facility being granted the Center of Excellence Award, let's take a look at the process flow, no? So as Dr. Cora mentioned earlier, no, that the health facility should conduct or do a self-assessment, no? And then they would contact one of the three third-party accreditors and request them to conduct the survey that will assess their capacity and processes, no? If they do comply with benchmark standards, no? And then the third-party accreditor conducts the survey face-to-face and gather data as explained by Dr. Mark, no? And assess using the scoring and to determine that the facility complies with the benchmark standards, no? And then accordingly recommend to PhilHealth. So once the recommendation reaches PhilHealth, sorry. Okay. So the PhilHealth through the health health financing and policy service headed by Dr. Pargas reviews the application, and if they find or they concur with the assessment of the TPA, they would recommend to PCEO to grant the health facility the award for Center of Excellence. No? Okay, so through this process, TÜV Rheinland will assist the facility in 3 ways. So let's take a look at those ways by which we can assist you. No. So this is the certificate of our recognition, the recognition of TÜV Rheinland Philippines no, as a third-party accreditor. The first stage is capacity building, no? And aligning your system, finding out where you are at vis-a-vis the benchbook standard. No? Through this first stage, we offer 3 types of training. The first one is the awareness training, deepening our understanding of the benchbook standards. As you have listened earlier, the benchbook has several standards, no, and there are a lot of things needed for the TPA to look at in order to assess your compliance to benchbook standards. So the second training would be about documents review, no? Okay, so documentation training. And the final one would be the self-assessment training. While PhilHealth has provided to the public the self-assessment tool, you can download it in the website, but what we are offering through these 3 types of training is actually how to apply the standards, how to look at your documents, how to look at your processes, no? And see how these things, what you're doing in providing care, actually comply with the benchbook standards. So let's take a look at each and every type of training that we are offering. The first is in the awareness, I think, awareness training, no? As mentioned, the intention of this training would be to deep dive into various standards of PhilHealth benchbook. But we recommend that participants from the health facility would consist of a team, at least 2 to 3, depending on the size of your health facility or hospital. There's a question here that should the CQI committee of the hospital be the benchbook team? Well, I would say yes, but also there are hospitals that are smaller in size, no? They might not have a large committee, maybe an assigned person that can that is assigned to compliance of the facility in terms of licensing with DOH or the accreditation with PhilHealth. So what we would recommend for this particular training is at least 2 for the small sized health facility, no, or the entire committee to attend this awareness training. Why? Because we believe that quality assurance and continuous quality improvement cannot be done by a single person. No? As you have heard from Dr. Cora, the standards, the organizational as well as the patient-centered standards of benchbook cover quite a lot of hospital or health facility operations. And certainly one person would have difficulty in ensuring that the whole facility can comply and to monitor that, no, throughout the period of your award. So the output from this is actually to formalize your benchbook technical working group in your own health facility. Because in the second part or the second stage of our training, we would look at your documentation. So Dr. Mark again emphasized the different sources of evidence, when you are scored according to standards. So this training would allow us through your participation in this training to review your own documents, no? So the training is not just telling you, oh, these are what benchbook requires, but in fact, looking at the standards and looking at what you have and trying to assess where you are at in terms of complying or reaching the standards set by benchbook. So again, the participants in this training should be the technical working group or your CQI committee, however you may call that team that would look into your COE compliance or to work towards center of excellence. No? So the output would be the gap analysis. These are the standards and what you have, and let's but by the end of the training, you will know where you should focus your efforts on. And finally, while again, you can do self-assessment, why not? What we are offering in this training is to develop your capacity to do effective benchbook self-assessment. No? Sometimes when we are in the middle of the operations, we fail to see that, oh, we are doing this, which is actually what is being asked in benchbook. No? But sometimes we just fall maybe a little bit short minor perhaps improvement can already do a better outcome. So these are the things that we will help you with, walk you through the self-assessment, and provide you tools and procedures to have better self-assessment. And this report you can bring back to your management, to the management of hospital. So the second stage is the actual assessment. So the assessment of health facility for Center for Excellence. So after the capacity building, the self-assessment training, you are now ready to be assessed. So the process here is that as the circular of PhilHealth mentioned, you will now indicate your intention by writing to TÜV Rheinland of your intent to be assessed using the benchbook standard. And once you are granted or awarded this as the Center of Excellence, we are mandated to monitor your performance to ensure that it is maintained. So we do monitoring visit. And then of course, we also at the end of the 3 years effectiveness of your COE award, we will remind you that to submit for renewal. I think there's a lag, no? Okay, so we will also again facilitate the renewal of your COE. So that's the second stage, no? So we do the actual survey, we visit your health facility, we review your records, and we interview your managers, your doctors, the hospital staff, even the patients themselves. And we assist you in the scoring based on the performance and the documents that we have reviewed. And the monitoring visit, we always look back on the benchbook standards. When we visit, we will be looking at where you are kind of on the border when we first assessed you, no? To ensure that those standards were kept in the meantime, no? So that you were able to maintain the standards that were the basis for your COE award. Of course, the monitoring visit will bring to light some areas that need to be improved on, no? To ensure and to continue our quality improvement efforts. And of course, we will conduct assessment 6 months before the expiry of your COE, no? So that we can report back to PhilHealth that for your renewal. So the last stage or the third part of our services as TPA would revolve around consultancy services, no? Based on the findings of the stage 2 services. So the intention of the assessment, of course, is for your hospital to receive as the Center of Excellence Award, no? So to be successful in that and to maintain your status as Center of Excellence. But in the process of assessment or monitoring visit, we could find out, some areas for improvement, and we need to investigate them. This will be a small consultancy service already that is outside the stage 2. So we help you assess these findings, go deep into the root causes of these areas for improvement, no? And then provide you solutions, no? Recommendations on how to improve those areas. So to give you examples on what this might be, for example, we could investigate specific assessment findings as mentioned, no? So from the findings that we gathered, we could identify problems like there's the need for policy development, like drafting of procedures for guiding patients, no, to alternative care when it is not available in your health facility. Because in accreditation, PhilHealth allows partnership with other health facilities. Maybe you don't have that policy yet. We can facilitate in drafting that particular procedural guideline for your use in your facility, no? Of course, we can also help you with strategic planning, for example. So these two examples are referenced in the benchbook standard, no? With the particular group of standard like access to care, no? And what particular indicator that would respond to it. Okay, so another example might be addressing emerging compliance risks, no? So there's a need to resolve issues that arising from situation or events that would impact your status as Center of Excellence, no? So this might be staffing challenges, no? With this high demand for our nurses, for example, you're losing nurses that would affect not only actually your accreditation, but maybe even your licensing compliance, no? So these kind of examples, we can help you find solutions. Of course, at the end of the day, it's the decision of the hospital which direction to take, no? Or which of the recommendations we provide would be taken and implemented. Another example that comes to mind is the reason that your COE award might be withdrawn, no? Dr. Cora earlier mentioned fraudulent cases is one of the reason that the COE award can be withdrawn. Of course, there's a process before your case may be deemed fraudulent case. So from the regional PhilHealth office to quality assurance committee or even to legal department of PhilHealth, no, there's a process when there's a complaint or there's a findings, no, in the claims that we filed as health provider, no, when we file up for our claims. So when these cases happen, before they become before the case becomes final and executory, we can provide the services to help you address those kind of problems at the beginning. No? So to summarize the services that we provide as TPA, in TÜV Rheinland, we build your capacity, as a preparatory service for you to become center of excellence. And then through the assessment, so we put here the process that I have discussed with you, and then the continuous improvement that I have given you examples of. Okay, so to summarize again, I think I've given you reasons why you can choose TÜV Rheinland to be your TPA, your journey towards becoming and maintaining your status as center of excellence. Over to you, Mike. I just realized it's 3:28. Okay.
Thank you so much, Dr. Lizelle, right? Okay, so we'll go to the part wherein we will answer two questions, okay, from our Q&A, and we will be calling Doc Mark and Doc Cora to answer them. So let me just show my screen here really quickly. Okay. So the first question is, I think this is for Doc Mark. So the question is, how can Benchmark 2 or second edition be integrated or aligned with our existing quality management system? So for instance, is there a prescribed format for documenting policies and procedures under the bench book framework? Doc Mark?
Yes, that's a common question, no? Usually benchmark is not prescriptive. So as long as you understand the standard and the elements in the evidence that you will present to the surveyor satisfies the standards, then that will be fine.
Perfect. All right. Now, for the second question, okay, and I think this is in regards with the presentation of Dr. Cora. So please clarify on the number 4 item on withdrawal. So if a recognized third-party accreditor is withdrawn, will the Health Facilities Center of Excellence certification will also be affected or revoked?
Yes, sir. I think I have answered it sa chat box natin. But then, let me clarify that the withdrawal of the COE, when the recognition of the TPA organization ceases, the award will still be allowed to continue until its end validity. That's for the clarification. Thank you.
Thank you so much, Doc Cora. All right. Okay, I'll be handing over to Mike. Mike?
Hello. Good afternoon, everyone. So that brings us to the end of today's session. We hope you find the discussion helpful and gain clear insights into how your organization can work towards the PhilHealth Seal of Excellence. As we've shared, third-party accreditation plays a key role in strengthening compliance, improving quality, and building trust with patients and stakeholders. Taking the right steps today can position your healthcare facility for a long-term success. At TÜV Rheinland, we're happy to support you on this journey, whether through assessment, guidance, or system development. Thank you for joining us. We'll be sending the webinar recording shortly so you can review it or share it with your team. If you have questions or need further assistance, don't hesitate to reach out. We appreciate your time and look forward to seeing you again in future webinars. Stay safe, stay committed to quality care. Thank you very much.
Thank
Thank
you.
you.
Bye-bye.
Thank
Bye.
you.